Hello everyone, I am Urologist Ömür Erdem Akkaya. The subject we will talk about today is fatty liver. What is fatty liver? Accumulation of simple sugars in the liver, which we eat and drink leading to impaired liver function. Why is it important? Well, it is very common nowadays. Approximately 10 to 24% of people have fatty liver disease. So what happens when you have fatty liver? It can lead to liver cirrhosis and liver cancer. Currently, one of the most common reasons for liver transplants today is fatty liver disease. What is the reason? We can say that people do this on their own. Simple sugars, fructose, glucose or carbohydrate overload, accumulate in the body due to the body's mechanism. The body stores them, and the liver is one of the organs that stores them in case of a shortage in the future. As fat accumulates in the liver, it starts to impair the function of the liver. So what happens when these liver functions are impaired? There can be a drop in testosterone. Erectile dysfunction can occur. This can lead to an increase in cholesterol in the body, deterioration of the vessel walls, and a process that progresses with heart diseases. Fatty liver disease is very important nowadays. How is fatty liver disease treated? Well, there are two very important treatments for fatty liver disease. They make up 80% of the treatment. It is actually a difficult situation. One is calorie restriction, weight loss, a diet option to reduce fatty liver disease. This leads to the Mediterranean diet. Here, the Mediterranean diet is very important. Especially fats rich in omega-3 should be preferred, and whatever you do, if you have fatty liver, you need to stop consuming foods that have a sugar structure such as glucose and fructose. When you remove glucose and fructose from your diet, the liver responds quickly. The second or the most important part is to move, to do sports or to exercise. The most important thing is to exercise for 30 minutes 7 days a week. Especially resistance exercises are very good for fatty liver. The third one is what we call periodic fasting or intermittent fasting. What is the purpose of it? Intermittent fasting is done in order to trigger some mechanisms in the body by starving the body, to remove fats and carbohydrates from the liver, and to activate the body's fat-burning mechanism. It is a very healthy situation. In fact, periodic fasting from time to time is recommended. And apart from that, increasing vitamin D levels, and using omega-3 externally can be useful. But as I said, the first two and third strategies are very, very important. You do not necessarily have to be overweight to have fatty liver disease. It can be detected with a simple ultrasound test. A biopsy can be performed if necessary. Why is fatty liver disease important for us? Erectile dysfunction is more common and testosterone levels are significantly lower in those with fatty liver disease. Because recent studies have found a very serious relationship between fatty liver disease and low testosterone levels. It is also related seriously to erectile dysfunction. Also, fatty liver is one of the most significant causes of the development of chronic diseases such as diabetes and high blood pressure. Therefore, patients should be very careful about fatty liver disease. Can testosterone therapy help a patient with fatty liver disease? There are studies on this. If the testosterone level is low, and there is fatty liver disease, it can be improved after 6 to 12 months of testosterone therapy. But there are publications that say this is not the case. What I believe is that if we give testosterone externally, if the patient also diets and exercises, exercise adaptation will be much better, and if we can control estrogen as well, the patients will respond very well to this and fatty liver disease may improve. Of course, the patient should be evaluated holistically. Other diseases must also be intervened. In a nutshell, this was information about fatty liver disease. Apart from that, if you want to contact me for online counseling, my phone number is given below. You can reach me on WhatsApp from that number. If you have any questions, you can reach me there. Thank you for listening. Best regards.